Good afternoon, everyone, and welcome. Thank you so much for joining our webinar today. The webinar is called the Affordable Care Act 101, What the Healthcare Law Means for Small Employers. My name is Ria Aguinaldo. I am an outreach manager with Small Business Majority, and I will be your moderator. We're very pleased to present this series with our partners at the Centers for Medicare and Medicaid Services and the U.S. Small Business Administration. And we're happy to have on the line with us representatives from each of those federal agencies who will be delivering the presentation and the content today. So we have Regional Administrator Calvin Goings as well as Laura Eldon from CMS. But before we get started, I do have a couple of quick housekeeping items to announce. First, please note that this call is off the record and not for press purposes. If you are a member of the press and you'd like to speak to someone about the Affordable Care Act, please feel free to respond to any of the emails that you received about today's presentation. You should have received a confirmation email or a reminder email. Just go ahead and respond to that, and we'll be sure to connect you with the appropriate person to chat with. Second, we will share the slides after the webinar. And we'll go through a number of slides here. We'll have lots of great information that we're going to cover. So if you wanted to get access to that slide deck, we will send that email after the webinar wraps up. And then finally, we will take questions at the end. So feel free to type your questions in the chat box in the lower left-hand corner of your screen. And we will take those at the question and answer portion. All right, now with that, I'd like to turn it over to our first presenter, the U.S. Small Business Administration Regional Administrator Calvin Goings. Regional Administrator, go ahead and please take it away.
Great. Well, thank you very much, and thanks to the Small Business Majority for hosting today's webinar, as well as our partners at CMS for participating in this very important webinar. And most importantly, thank you to all of you. Thank you for taking time out of your schedules. You know, for small business owners, that often means that phones are going unanswered and emails aren't being responded to. So thank you again for investing your time on this very important subject. Well, let's get right into this issue. You know, for years, small businesses have reported that their number one concern has been access to affordable health care. Now, before the Affordable Health Care Act, the ACA, small businesses paid on average 18% more in premiums than their larger competitors for the same benefits. So the ACA helps small employers by lowering premium cost growth and increasing access to quality, affordable health insurance. Now, before the Affordable Care Act, small employers faced many obstacles to covering their workers, whether it was too few choices, higher premiums and unpredictable rate increases, or higher rates for groups with women, older workers, and those with chronic health concerns or high-cost illnesses in most states, and waiting periods or no coverage for individuals with pre-existing conditions. Now, under the ACA, insurance companies face limits on administrative spending, and most insurers must now spend at least 80% of the consumer's premium dollars on actual medical care. Most must also disclose and justify proposed rate hikes of 10% or more, and can't charge higher rates or deny coverage because of a chronic or pre-existing condition. Additionally, they can't charge higher rates for women, and they face limits on charging additional premiums for older employees. They must also pool their risks across small groups, creating larger pools like large businesses. They can't have annual dollar limits on their coverage, and most must offer plans that provide a core package of essential health benefits equal to typical employer plans in that state. So how does the ACA impact small employers? Well, it really depends on the size and how many employees the employer has. And so let's get into those various scenarios. So let's start by talking about small business health care tax credits. Now, for employers with 24 or fewer FTEs, so 24 or fewer full-time employees, if these smaller employers provide coverage, they may qualify for a small business health care tax credit to help offset their costs. Now, in order to do that, they must have an average annual wages below $50,000 and contribute a uniform 50% or more towards their employees' self-only premium costs. Now moving on to the next slide. For example, in 2010 to 2013, up to 35% of eligible small employers' premium contributions were eligible for the healthcare tax credit. In 2014 and beyond, that tax credit went up to 50% or 35% for tax-exempt employers. Now, to take advantage of the credit, employees must enroll in coverage offered by an employer through one of the SHOP certified plans. And the credit can be claimed for any 2 consecutive taxable years beginning in 2014. And you can see the website there to figure the SHOP tax credit estimator. And there is a transition relief for employers with plan years differing from their taxable years. Now, for the small business tax credit, if an employer has 24 or fewer full-time equivalent employees, to recap, plus their average annual wages are less than $50,000, and the employer pays a uniform amount of at least 50% of employees' self-only premium costs, then again, they are eligible to up to 50% federal tax credits towards those premiums. Now, for employers with up to 50 FTE employees, if a small employer of this size chooses to offer coverage, there is a new way to do so, and that's through our Small Business Health Options program, SHOP Marketplace. And this really has enhanced the small business healthcare tax credits available for eligible employers with 24 or fewer employees participating. Now, to get into the SHOP Marketplace, I'll turn it over to my colleague at the CMS.
Great, thank you. And I'll just echo my colleague's comments that thank you to the Small Business Majority for having us and for all of you for taking time out of what I'm sure is a very busy schedule to come and join us today. So this portion of the presentation is going to provide an overview of the SHOP Marketplace available on healthcare.gov and the application and enrollment process for 2017. We're going to be focusing on the SHOP Marketplace that's run by the federal government and located on healthcare.gov. Some states are running their own SHOP Marketplace, and those marketplaces might operate a little bit differently. So if you're unsure whether your state uses the SHOP Marketplace on healthcare.gov or runs its own SHOP Marketplace, please visit healthcare.gov for some more information. Next slide, please. So to get started, what is the SHOP Marketplace? So the Small Business Health Options Program, or the SHOP Marketplace, is part of the Health Insurance Marketplace, which is also sometimes called an exchange, and it is available in every state. It was created to make it easier for small employers to find and purchase health insurance for their employees. The SHOP Marketplace is open to employers with 1 to 50, that's 50 employees, and that's including nonprofit and religious organizations. The SHOP Marketplace offers a choice of health and dental plans and tools to help customers make informed purchasing decisions. Employers and their employees can submit an initial group enrollment for SHOP Marketplace coverage at any time of the year. After that initial enrollment is submitted and the coverage actually goes into effect, the SHOP Marketplace enrollments are limited to an annual enrollment period for employees, special enrollment periods, and enrollment periods for newly eligible employees. And as mentioned, in addition, if employers offer employees coverage through the SHOP Marketplace and they meet other eligibility requirements, small employers may be able to claim the Small Business Healthcare Tax Credit, which could be worth up to 50% of their premium contributions and up to 35% for those tax-exempt employers. The SHOP Marketplace now lets small businesses find and enroll in coverage online all through healthcare.gov. Renewals also take place in the SHOP Marketplace on healthcare.gov. And through the SHOP Marketplace, small employers are able to offer their employees a choice of health plans, much like large employers do. And those small employers with fewer than 50 full-time equivalent employees are not required to offer their employees health insurance, and there's no penalty if they choose not to. Next slide. So what are some of the benefits of the SHOP Marketplace? There are quite a few. The first one that we'll start with is that the SHOP Marketplace gives employers convenience and choice. As I mentioned, the SHOP Marketplace is open all year, so that means that small employers can submit their initial group enrollments during any month at any point of the year. I will note that in the SHOP Marketplace, if an employer's initial group enrollment is completed between the 1st and the 15th day of the month, coverage could begin as soon as the first day of the next month. So for example, if an initial group enrollment is completed on October 10th, the group coverage could begin as soon as November 1st. And for those initial group enrollments that are completed after the 15th of the month, coverage could begin as soon as the first day of the second following month. So for enrollment completed on October 18th, group coverage could begin as soon as December 1st. And as I mentioned, small employers, agents and brokers, and any navigator or assister that might be helping them can browse, compare, and apply for health and dental plans all on healthcare.gov. The SHOP Marketplace also offers small employers control over spending, which I know means a lot for a lot of you businessmen out there. So through the SHOP Marketplace, small employers have the option to offer their employees, and if applicable, their dependents, a choice of health and dental plans, either across one plan category, which we'll talk about in a little bit, or they can also choose to offer a single health or dental plan that the employer chooses. And in some states, beginning for this current plan year, so employers in applicable states can begin to do this now, they're also able to offer their employees a choice of plans by health insurance company. And once again, we'll talk about kind of a little bit more details of that later in the presentation. And despite an employer's ability to offer their employees a choice of health and dental plans, each month the employer will receive and pay just one monthly bill. The SHOP Marketplace takes care of dispersing all of the payments. Employers also get to decide which plans they want to offer to their employees and how much they actually want to contribute to their employees' premiums. And employers have the ability to decide if they want to offer coverage to their employees' dependents. And if they want to offer dependent coverage, they also get to decide how much to actually contribute to their dependent costs. And as we've talked about, the SHOP Marketplace also gives eligible small employers access to the Small Business Healthcare Tax Credit, which may be worth up to 50% of an employer's premium contributions, and once again up to 35% for those tax-exempt employers. And finally, the SHOP Marketplace also offers many ways to get help. Employers can search for an agent or broker or other assister in their area through the Find Local Help tool on healthcare.gov, and they can do that without even creating an account. The SHOP Call Center is also available to assist agents and brokers, employers, employees, and navigators and assisters. And I'll provide the phone number and the hours for the SHOP Call Center later in the presentation. Next slide. So which employers can actually participate in a SHOP Marketplace? In most states, the SHOP Marketplace is open to small employers with 1 to 50 employees. Some states that are using the SHOP Marketplace may allow employers with up to 100 employees to participate, but all of the states that are currently utilizing the healthcare.gov platform, the SHOP Marketplaces are open to those employers with up to 50 employees. So in order to purchase coverage through a SHOP Marketplace, employers must first meet some criteria. The first one, evidently, is that they must be a small employer. And again, we define a small employer as generally one that has fewer than 50 employees. The second piece is that the employer must offer coverage to all full-time employees. So a full-time employee is defined under the ACA is defined as one that's working 30 or more hours per week on average. Part-time workers whose combined hours total at least 30 hours per week are also included when determining SHOP Marketplace eligibility. And healthcare.gov does offer an online tool called the SHOP FTE Calculator that can help employers and those assisting them count how many full-time equivalent employees they have for the purposes of determining SHOP Marketplace eligibility. The next piece is that employers must have at least one employee who's on payroll and enrolling in coverage who is not a business owner or spouse to be eligible to participate in the SHOP Marketplace. I'll repeat that because we do get this question a lot. In order to participate in the SHOP Marketplace, employers must have one employee on payroll actually accept the offer of coverage in order to enroll, in order for the entire group to enroll in SHOP Marketplace coverage. And that one employee cannot be a business owner or a spouse or a family member. They must be a separate employee. The last piece is that employers must also have a principal business address in the state in which they are offering coverage. For those employers who have employees in more than one state, they do have a few options when it comes to deciding how they'd like to offer coverage. The first is that the employer can choose a single health plan with a multi-state or national provider network and offer it to all of his or her employees in all of the business locations. Or the employer can choose to create a SHOP Marketplace account in each of the states where the employees have a primary work site, as long as the business in each state meets all of the criteria that we've discussed above to participate in the SHOP Marketplace. Next slide, please. So self-employed individuals, sole proprietors, or shareholders of more than 2% of an S corporation that has no common law employees can't buy insurance through the SHOP Marketplace. But these individuals and their spouses may qualify to buy insurance through the Health Insurance Marketplace for individuals and families, also on healthcare.gov. And depending on the level of household income, as individuals, the self-employed and sole proprietors may qualify for tax credits through the Health Insurance Marketplace. I will note that while eligible small employers can complete an initial group enrollment at any time of the year through the SHOP Marketplace, individuals who are using the Health Insurance Marketplace for individuals and families generally must enroll during the open enrollment period. So open enrollment for 2017 coverage began on November 1st, and it's going on right now, and open enrollment will end on January 31st, 2017. Outside of open enrollment, however, sole proprietors, self-employed individuals, and their families may be eligible for a special enrollment period in the Health Insurance Marketplace if there is a change in life situation, which is also sometimes referred to as a qualifying life event, and also in certain other limited circumstances. Some examples of qualifying life events include moving to a new state, certain changes in income, and changes in family status or size, like if they're getting married, getting divorced, or having a baby. Next slide. So the next topic I want to talk about is the SHOP Marketplace minimum participation requirement. And before employees can complete an enrollment in a SHOP Marketplace plan, the employer will need to meet the minimum participation requirement for their state. In many states that are using a SHOP Marketplace on healthcare.gov, at least 70% of the business or group's employees who are offered coverage must accept that offer of coverage before any of the employees can enroll. I'll just note that some states and issuers may also set different participation requirements for small group plans that are offered outside of the SHOP Marketplace. In a few states, the SHOP Marketplace does have a different minimum participation rate. There is a handful of states that might have a participation rate of 75%, but for the most, on the whole, most states have a participation rate of 70%. But we do encourage you to visit healthcare.gov for some more information. We do have a calculator available on healthcare.gov that we call our NPR calculator that can help employers and those who might be assisting them predict if they might meet the minimum participation rate for their state before they go through the application process. I will highlight that there is an exception to the minimum participation rate requirements, and that's from November 15th through December 15th of each year. Employers can buy small group coverage through the SHOP Marketplace without having to meet the minimum participation rate that we just talked about. So if you're a small business and you're concerned that you might not have enough employees to meet that threshold, if you enroll between November 15th and December 15th, you don't have to worry about that as long as you meet all the other eligibility requirements for the SHOP Marketplace. Next slide. So I want to dive in a little bit deeper just to further explain how the rate is actually calculated. So the employer's participation rate is determined by taking the number of employees who are enrolling in coverage offered through the SHOP Marketplace and dividing it by the total number of employees who are actually offered coverage. All employees who are enrolled in qualified health coverage will be counted towards an employer's minimum participation rate, which will make it easier for employers to enroll their small business and SHOP Marketplace coverage. And if you're looking at this and saying, I don't want to do this equation, I have good news for you. Employers don't need to calculate the minimum participation rate themselves because the SHOP Marketplace application will monitor participation based on employees accepting or waiving the SHOP Marketplace coverage offer. So the SHOP Marketplace application actually does all of the calculating and everything for you. Once you, the employer, have gone through and typed in all of your business information, made the plan, decided how you'd like to offer coverage, and actually send the coverage offer out to your employees. Your employees will have to will receive their notification via email, and they'll have to review. They'll have to create a healthcare.gov account to review your coverage offer. If they accept or decline, the marketplace, that's how the marketplace collects its information and will calculate the rate for you. But once again, we do have a calculator that if you'd like to get ahead of the game a little bit to see if you might meet the minimum participation rate in your state, please check out the minimum participation rate calculator that's available on healthcare.gov. And once again, this window did just close, but there is an exception to the minimum participation rate requirement, and that's from November 15th through December 15th of each year. As long as your business meets all of the other eligibility requirements for the SHOP Marketplace, you don't need to worry about meeting the minimum participation rate. Next slide. So what are the options for employers when they actually decide that they want to offer coverage in the SHOP Marketplace? So the SHOP Marketplace offers both health and dental plans, and employers have three options when it comes to deciding how they'd like to offer and coverage to their employees and, if applicable, their employees' dependents. So as the employer, you have the ability to decide if you want to offer only health coverage, only dental coverage, or both health and dental coverage. I will note that if an employee is offered both health and dental coverage, he or she may choose to enroll in both health and dental coverage, only health coverage, or only dental coverage. So the employer has a lot of options here, but the employee will as well. And if the employer chooses to offer coverage for their employees' dependents, the dependents will have the same enrollment options. However, the employee must first enroll in health or dental coverage before the dependents can enroll. The employees and the dependents must enroll in the same health and or dental plans. Next slide. So now we're going to revisit this idea of employee choice that I touched on a little bit earlier. So when employers offer health and dental coverage through the SHOP Marketplace, they can offer their employees, and if applicable, their dependents, either a single health or dental plan that the employer selects, or they may offer a choice of health or dental plans across one plan category. And new for the 2017 plan year, which is happening right now, is the option for employers in some states to offer their employees a choice of plans by insurance company. And with this option, employers can select an insurance company, and the employees get to select any plan across all plan categories that's offered by that insurance company. So through employee choice, employees get a choice of health and dental plans, but the employer gets to set the basic limits by deciding which category or which company of plans to offer and how much they want to contribute to premium costs. And offering employees a choice of plans can provide advantages for both employers and employees, because it means less hassle for the employers because they don't need to spend as much time trying to select one plan that will meet the needs of all of their employees. And it also means that the employees can select the plan that works best for them. And offering employees a choice of health plans, as many large employers do, can help a small business attract and retain valued employees. And when employees can choose their own plan, insurers have to compete for their business, which can lead to lower costs and also better service. And with the SHOP Marketplace, more choice also comes with less paperwork, because no matter how many different insurance companies or plans your employees might select, the employer gets and pays just one monthly bill. The SHOP Marketplace will take care of dispersing all of the payments to the different companies. Next slide, please. Oops. And this slide, once again, just highlights all of the benefits of offering your employees a choice of plans through the SHOP Marketplace. And this choice and flexibility piece is really only available through the SHOP Marketplace. Next slide. So before employers begin their SHOP Marketplace application, they can visit healthcare.gov to get a look at some of the price estimates for all of the health and dental plans that are offered by the SHOP Marketplace in their area by using our See Plans and Prices tool on healthcare.gov. To use the tool, users will just answer a few quick questions, such as whether they're looking for health benefits or dental benefits or both, and select the state where their primary business address is located. The price estimates that will then be generated are based on the age ranges of the employees and where the business is actually located. And those estimates reflect prices for people who do not use tobacco. Insurers are allowed to charge higher premiums for tobacco users. Agents, brokers, and navigators can help employers use this tool and make the plan comparisons. I will note that neither the price estimates on healthcare.gov nor the final quote will reflect any savings that an employer might be eligible to receive through the Small Business Healthcare Tax Credit after they file their tax returns. Next slide, please. So now that we've talked about kind of the mechanics of the SHOP Marketplace, we're going to get into how employers can actually enroll. So there are two ways that employers can enroll in the SHOP Marketplace through healthcare.gov. And the first is that they can enroll with a SHOP Marketplace registered agent or broker. And the way that they do that is that the employer will have to create a healthcare.gov account, visit the SHOP Marketplace, and they can search for an agent or broker once they get into their account. And agents and brokers can be searched for by either their name, their national producer number, or an employer can simply add their location, and a list of registered agents and brokers in that area will then populate. And once an employer finds an agent or broker that they'd like to work with, the employer will need to authorize the agent or broker to work on their behalf. That authorization just grants the agent or broker access to the employer's healthcare.gov account and their application. And once authorized, agents and brokers can complete all application and enrollment functions on behalf of an employer client except for making payments. Employers must make all of their payments to the SHOP Marketplace themselves. Next slide. The other way employers can enroll in the SHOP Marketplace is on their own. Employers will just need to create their own healthcare.gov account, select their state, and fill in all of the necessary information and make the offer to their employees. We do have a lot of information on healthcare.gov about how to actually enroll, and we do also have a series of YouTube videos that are available on YouTube, but they're also sprinkled throughout the SHOP Marketplace healthcare.gov pages that will actually show you how to go through the application process. Next slide. So just to wrap up, as I mentioned earlier, the SHOP Marketplace does offer many ways to get help. The SHOP call center is available Monday to Friday, 9 a.m. to 7 p.m. Eastern. And the SHOP call center is open and available to help agents and brokers, navigators, assisters, employers, and also employees that have an offer of SHOP Marketplace coverage. Small employers, once again, can find a SHOP Marketplace registered agent or broker or local navigator for help with their SHOP Marketplace application and enrollment using either Find Local Help on healthcare.gov or through their the actual SHOP Marketplace application. Lastly, for those self-employed individuals with no employees who might be on the line, the Marketplace Call Center is available 24/7 to answer any questions that you may have about your individual and family coverage. And with that, I'll turn it back over to Calvin at the SBA.
Wonderful. Well, thank you. So we've been talking about these three groups, 24 or fewer FTEs, up to 50, and now to kind of end with 50 and above. So let's talk about the employer shared responsibility for employer health care insurance coverage. So again, talking about employer shared responsibility provisions for those with 50 or more. So nearly all small firms are exempt from the employer shared responsibility provisions of the ACA. It exempts all employers that have fewer than 50 full-time employees. Nearly 96% of all firms in the United States, about 5.8 million out of 6 million total firms, are exempt. These 5.8 million firms employ nearly 34 million workers. Many employers that do not currently offer coverage will be better able to do so because of the lower costs and wider choices in the SHOP marketplaces. So let's talk about some key definitions around the employer shared responsibility provisions. So first, full-time employee is an employee who is employed on average 30 hours or more per week. Now a full-time FTE, a full-time equivalent employee, is a combination of employees, each of whom individually is not a full-time employee because they are not employed at least 30 hours a week, but who in combination are counted as the equivalent of a full-time employee. And the third definition is a controlled group employers. Employers with common owners or who are otherwise related are aggregated together to determine whether or not they meet the threshold number of 50 or more full-time employees. So some of the provisions: if an employer meets the 50 full-time FTE employee threshold, there are two scenarios for potential payments under the employer shared responsibility provisions. Either one, an employer does not offer coverage to at least 95% of its full-time employees, or two, the coverage offered to employers' full-time employees is not affordable or does not provide a minimum value, or particular full-time employee was not offered coverage, and at least one full-time employee receives a premium tax credit in the individual marketplace. So now let's talk about some of the insurance coverage standards of employer shared responsibility. Coverage provides a minimum value when the plan, on average, at least 60% of the plan's total cost of incurred benefits, and HHS and IRS have an online calculator employers can use to input their plan details and determine if it meets the 60% value threshold. Coverage is affordable. Now, coverage is unaffordable if the full-time employee's share of the lowest cost self-only coverage that provides a minimum value costs more than 9.5% of his or her annual household income. Now, moving on to possible payment scenarios, two scenarios. If coverage is not offered to at least 95% of full-time employees and their dependents, then payment applies if any full-time employee receives a premium tax credit for coverage purchased in the individual marketplace. Now, the payment owed can be $2,000 a year times the number of full-time employees in excess of 30. The payment is calculated separately for each month for which coverage was not offered, and payment is based on the employer's number of full-time employers for that month. Now, if coverage is offered to full-time employees but either it's not affordable or does not meet the minimum value, then a payment is owed $3,000 per full-time employee who receives the premium tax credit for coverage purchased in the individual marketplace. And the payment is calculated on a monthly basis. This payment can't exceed the payment described in Scenario 1. Now, some other key points to employer shared responsibility provisions. Whether an employer will owe a payment depends on whether it offers coverage and the quality of the coverage it offers, rather than whether an employee accepts the offer of coverage. No employer payment is owed for part-time employees, even if they receive a premium tax credit. Only the receipt of the premium tax credit in the individual marketplace triggers these payments. In order not to be subject to an employer payment, employers that offer coverage to full-time employees must also offer coverage to the dependents of those full-time employees who are children under the age of 26. The cost of providing coverage is tax deductible by the employer. By contrast, employer shared responsibility payments are not deductible. Employers that offer coverage have greater flexibility to tailor the coverage to provide those benefits most valued by their workforce, and will enjoy competitive advantage in recruiting and retaining employees. Now, some other important definitions and reporting requirements. Let's first talk about those reporting requirements for applicable large employers. The first reports were due in 2016. Employers are encouraged to furnish statements to individuals and file their information returns with the IRS as soon as they are ready. Information reported includes the employer's identifying and contact information, the number of full-time employees, and information for each full-time employee, including the coverage offered, the lowest employee cost of self-only coverage, and the months the employee was covered if applicable. Some other information and reporting necessary for applicable large employers: the transmittal of employer-provided health insurance offer and coverage information on Form 1094-C, which is submitted to the IRS, as well as the information on the 1095-C, which is provided to the employees as well as submitted to the IRS. Now, some of the information reporting for providers of minimum essential coverage. Insurers self-insured employees, government agencies providing government-sponsored coverage, and employers of miscellaneous minimum essential coverage were also required to report in 2016 for the first time. And this included the coverage provided, and they are encouraged to provide statements to individuals as well as filing their information returns with the IRS as soon as they are ready. And again, some of the information that was to be reported and is to be reported is the name and contact information for the insuring entity, the identifying information of persons covered and months covered, and the name and employer identification number provided to the insurance group health plan. And again, some of the forms that are necessary for those with the minimum essential coverage is the 1094B, which is required to be submitted to the IRS, and the Form 1095B, which is provided to the policyholder and other responsible individuals and submitted to the IRS. Some other ACA provisions impacting small businesses, the W-2 reporting of annual health care costs. Employers who are covered must notify new hires about the health insurance marketplace. Plans can't impose waiting periods for more than 90 days for otherwise eligible new hires to begin coverage. Employers may use additional incentives and rewards under workplace wellness programs, such as max reward increases to as much as 50% for smoking cessation programs. And finally, there is some wonderful resources. You can see the websites there on your screen to reach out for additional information regarding the Affordable Care Act and the provisions that we've discussed on today's webinar. And we'll send it back to the Small Business Majority.
Great. Thank you so much. All right. So with that, now we'll go ahead and jump right into the question and answer portion. First off, thanks so much for Laura and Calvin for the great information on both SHOP, the Small Business Health Insurance Tax Credit, and the Employer Share Responsibility provisions. All right. So give me just a minute here to go through the questions and then make sure that we get to all of these. First off, we did have a few questions about the slide deck. Again, we will be making the presentation available to you. It will be emailed as an attachment to the email address that you used to register for this webinar. Also, if you do have any other questions regarding your coverage, as you're going through the slides and sort of reviewing all the information that we went over today, feel free to please reach out to us. We're happy here at Small Business Majority. We've been very focused both in person and online on the education piece and making sure that you have all the resources and sort of the in-person assistance that you need to get the coverage that you are looking for your employees, as well as connect you with local experts, local agents on the ground that can sort of work one-on-one with you. All right. Now with that, I'll go ahead and now turn it over to Laura Eldon, who will jump right into the question and answer portion. And again, if you do have any other questions, feel free to type them into the chat box, and we will get to those. Laura, go ahead and take it away.
Great, thanks. So thanks everyone for sending in questions. We've got a lot of good ones here. I'm going to try to group some of these together because they are a little bit similar. So the first one I'll take is there an enrollment period in the SHOP Marketplace? And that's a great question. So one of the things about the SHOP Marketplace is that it's open all year. So if you're an employer and you're submitting an application or you're enrolling in your business in SHOP Marketplace coverage for the first time, you can submit that application at any time. There's no limited open enrollment period like there is for the individual marketplace. The only deadlines that I would keep in mind are that applications that are submitted by the 15th of the month will go into effect as soon as the first day of the next following month. So if you submit something on January 3rd, your coverage would go into effect on February 1st. But if you were to submit your application today on December 22nd, that would go into effect also on February 1st, because for those enrollments that are submitted after the 15th of the month, your coverage would begin as soon as the first day of the second following month. So there would be a little bit of a gap there. But the shop is open all year, so just one deadline again to keep in mind. This is what we call the 15th of the month rule. So the next question is if my business is just me and my spouse, can I enroll in Shop Marketplace? So the answer to that, unfortunately, is no. In order to enroll in Shop Marketplace coverage, your business must have one employee on payroll who is not a business owner or spouse actually accept and enroll in the coverage that you offer. So if you and your spouse have one additional employee who also enrolls in the coverage, then you're good to go to enroll in the Shop Marketplace. But if it's just you and your spouse, then the Health Insurance Marketplace for individuals and families, also on healthcare.gov, would be where you would get your individual and family plan. There's a question here on if brokers get paid and if employers pay that. So the answer to that is yes, brokers do get paid for their service, but no, you, the employer, does not pay for that out of your pocket. Agents and brokers are compensated by health insurance companies, so their compensation is built into your premium cost whether or not you use one or not. And there's a great question here about if there are any changes to coming for the Shop Marketplace in 2017 with the change of administration. So the thing that I will tell you is that we've received word from the various health insurance companies that are participating in the marketplace that those plans, so any plan you enroll in during the 2017 plan year, will take place for the duration of the year. So if you're worried about your 2017 coverage, don't be, just enroll and you will be covered for the year. And then when you're upon renewal next year, any changes that might need to take place, I think is when you would deal with those. But for right now, we're going forward strongly for the next year, and the health insurance companies have confirmed that they will be keeping their plans for 2017. So if you enroll now, your 2017 plan will be just fine. There's a question here if an employer with 10 employees would benefit from SHOP versus buying plans through a broker. Many agents and brokers are registered to sell Shop Marketplace plans. So if you work with a broker and you mention that you're interested in the Shop Marketplace, especially if you want to claim the small business healthcare tax credit, if your broker is registered with the marketplace, they can certainly help you do that. But as for benefits to employers from the Shop Marketplace, of course, if you have 10 full-time employees, you are potentially eligible for the small business healthcare tax credit, so that might be something that might be attractive to you, and that's only available to those employers who enroll in Shop Marketplace coverage. And also, only through the Shop Marketplace are you able to make the coverage selections that you are. And what I mean by that is, as the employer, you can decide if you want to offer one health plan to your employees, or if you want to offer a choice of plans across metal categories, or choose an insurance company and offer all plans to your employees that's offered by that insurance company. So you do have a lot of choice and cost control through the Shop Marketplace that you won't find out in the private market. And again, just as a reminder, even if you offer your employees a choice of plans, you'll only receive and pay one monthly bill, and you'll pay the Shop Marketplace, and the shop will then disperse all of the premium payments to the different companies. So as a thought of choice, if you're seeing a lot of paperwork in your head, don't worry about it. The Shop Marketplace takes care of dispersing all of the different payments. So there's a question here about if I have employees in multiple states. So through the Shop Marketplace, you have a couple options. You can either create one Shop Marketplace account where the primary address of the business, is located, and you can offer plans to all of your employees in all of the states. You can just search for plans that have a multi-state or national provider network to ensure that all of your employees in all of the states can actually use the health coverage. Or you can create a Shop Marketplace account for each of the states in which you have a primary business address, and offer the coverage to the employees in each of the states, as long as the business locations all meet the eligibility requirements for Shop Marketplace coverage. Let me see. I think those are all the questions that have come in related for SHOP. If you're typing, we'll give you another minute or two, but if not, I think we're all set to wrap up.
All right. All right, great. So, so with that, I'm sure that there will be more questions coming in. And what we'll go ahead and do here, I'll put up this last slide here. Here's my contact information. Again, as I mentioned, please feel free to reach out to us. As you're navigating through the resources here and the information on the slides, and as you're taking a look at your group, your business and your group, we are happy to sort of help you find the assistance that you need. With that, we'll go ahead and wrap up. I do want to just plug here our small business resource portal at Small Business Majority. It has a ton of great information around healthcare, as well as other small business information and topics to learn about. We do, in addition to healthcare webinars, we do host access to capital, retirement security, and other workplace benefits webinars as well. So please, again, feel free to reach out to us if you have any other questions. We do also host ongoing webinars and in-person presentations, and on that Small Business Resource Portal, you'll find a sort of running list of all of the educational events that we host. Again, thank you so much to Laura Elgin at CMS and Regional Administrator Calvin Goins with the SBA. Calvin, did you have any closing remarks before we wrap up?
Just again, thank you very much for the opportunity to participate today.
Great. All right, thank you. Okay, well, thank you so much for taking the time out of your very busy schedule to join us on this webinar, and this will conclude our webinar. Take care and have a very happy holidays. Bye-bye.